in the waiting room. So Alexis, can you bring them into the conference now? Wonderful. Good morning, everyone. This is Jill Ryan. I'm the Executive Director of Freshwater Future. We work to help people protect their own water. And we're here this morning to hear about how water impacts, or lack of water impacts disease spread like the COVID-19. I want to go over a couple of logistics. You're all going to be muted until the question time, just so we can keep things focused. And for those of you who are not speaking, if you would turn your video off at this point, please, that would be helpful. We also ask that you don't share this link during the video conference. It caused us some issues yesterday, so if you would keep that private and at least until after the call is finished, that would be great. We will be recording this meeting. We are recording this meeting, so everyone knows we will make it available publicly after the call. We are going to go quickly through several speakers. Monica Lewis-Patrick will begin, and then I will introduce the speakers. They will give their own brief introductions, and then we will go through all the speakers before we have a question and answer period. I am going to turn it over to Monica Lewis-Patrick from We the People of Detroit. Monica, can you hear us?
I can, Jill. Can you hear me?
We can, yes. It's all yours.
Thank you so much. Thank you, Jill, and thank you, Freshwater Futures. Definitely want to give a shout out to the teams, the media teams on both sides of We the People of Detroit and Freshwater Future for doing an amazing job of getting all of our guests back on the line today. I apologize for any issues with my sound because I'm out here in the community right now delivering water. But what we wanted to make sure that we were lifting today is that we wanted to talk about, with all of you attending today, this teleconference, and for continuing to prioritize and publicize issues around water access to clean water and water affordability. We the People of Detroit is happy to partner with organizations like Freshwater Future because water is a basic human need for everyone. The water issue is not specific to just Detroit and Flint, but we are fighting for all Michiganders to have access to clean, safe, and affordable water. I received a call just the other day from my friend BJ up in the UP, who's very concerned about rural communities that are finding themselves taxed with the inability to afford the replacement of their wells. So we're advocating for all Michiganders. And we are elated that our Governor Whitmer, has stepped up to answer our call to restore water to those who have been shut off. It's especially critical as we deal with the coronavirus outbreak. We all know that the first thing the Center for Disease Control tells us to do is wash our hands. Washing our hands isn't just for our personal protection, but it is a public health concern. If people aren't able to wash their hands, they can become carriers and proliferate the spread of infectious diseases such as COVID-19 to others. Again, we are very thankful to Governor Whitmer for leading our state in turning water on. Now we must ensure that the local government takes action. We must hold them accountable for acting with integrity and reporting the numbers of incidents in their jurisdictions and the rate at which they are restoring water services to the more vulnerable members of our communities. The governor's executive order mandates that the local water services provide reports to the State Emergency Operations Center. The report must include an account of the efforts that have been made to determine the number of homes that have been shut off, the number of occupied residents that have been shut off for non-payment, the number of occupied residents that have been shut off for reasons other than non-payment, and a certification that their best efforts have been made to reconnect water services to all occupied residents that have been shut off without creating a risk to public health. We are doing our part in flattening the curve by staying home. They must do their part by providing the primary resources that we have to stave off this disease, water to those that don't have it. We know that washing our hands and proper sanitation is always a primary method in preventing communicable illnesses. So even after the corona pandemic has passed, we must work together to develop an affordable water structure that will allow those that have been restored to maintain their water and access to proper sanitation. Jill, thank you so much for having me. We're gonna go forward and get water out, but I really appreciate all the doctors and everybody that's come forward to make sure that we're not only turning water on, but that we're keeping water on. Thank you.
Thank you, Monica. Very much appreciate it. And we're going to move directly to Dr. Wendy Sternberg, please.
Hi, yes, this is Dr. Wendy Sternberg from Chicago. And the purpose of my being on this call is bringing my background as a frontline primary care physician in internal medicine with a deep interest in infectious disease, having spent time in Southeast Asia, in India, looking at pediatric infectious disease and healthcare delivery at a time a number of years ago. I also am the founder and executive director of Genesis at the Crossroads, and we work at building peaceful communities at an intersection of human rights, social justice, education, and art. And I'd like to address a few things that I think are critically important to understanding the context in which hand washing is so important and water is so critical to dampening the spread and containing this hideous disaster. So I believe the timetable for all of this was completely off, and the horses were out of the barn by the time this came to the United States. I actually believe I had this illness in October 2019. I had every single symptom and was sick like no tomorrow in the middle of October for 3 weeks. We're also coming to find out that the Chinese have falsified most of their data, the occurrence, the infected people, the deaths, and as of a few days ago, they uncovered from 3 funeral homes 26,000 cremated urns. So the statistics are all off, and we're not clear of the denominator. There's also this notion that this is only spread through droplets, which is why social distancing can help us. I have always had the notion that this is not only spread by droplets, but rather by airborne. So if you're in a movie theater and somebody sneezes 5 feet behind you and that drop lands on you, then you're infected in airborne spread. But if all the people in the movie theater are with you in, that's droplet spread. In airborne spread, the same thing happens. The entire movie theater is now infected. So airborne is very important to think about because it makes this massively difficult to contain. Now we're finding out that the COVID-19 virus is in the fecal material of people infected. So think about diapering a baby. Think about a person who's taking care of an elder person who's incontinent or needs help going to the bathroom. If you can't wash your hands, how can you possibly contain this pandemic? It's also on surfaces like plastic and metal. So hand washing is absolutely key. It is unconscionable to turn off the water for anyone, not just in this pandemic, but just in general, it's unconscionable. In this pandemic, that issue rises to the level of criminality. So we need to look at also turning back on the water when the COVID-19 pandemic is over. We don't know when it's over. Flattening the curve doesn't make it over. It can continue in waves for a number of months, if not years going forward. We have to look at the intersectionality of this. If people at the margins are not aided and their water is turned off and they have more disease, that disease by airborne, by droplet spread, affects all of us. We're all in this together. So Detroit is actually a microcosm. It's been happening in the south suburbs of Chicago as well in terms of what I've learned. According to our water commissioner, no one's had their water shut off for non-payment since December 2018. What we need to think about is Detroit as a microcosm for the world, happening in Chicago. I've traveled and worked in the developing world, and I can tell you all that I fundamentally believe, even as a physician, if we had clean water here in Detroit, here in Chicago, in the United States and around the world, we would save far more lives than the drug industry is helping save. Thank you very much.
Thank you so much, Wendy. And we will move next to Dr. Wendy Johnson.
Okay, thank you very much. Yes, my name is Dr. Wendy Johnson. I am a clinical assistant professor at the University of Washington. I have a career that spans both public health and primary care medicine. I have been the medical director of the Cleveland Department of Public Health. So I'm originally from the Great Lakes area. And I currently now, I've worked in Africa, and I currently now am the medical director for a large community clinic in Santa Fe, New Mexico. So I've been on the front lines of this for the last few weeks in keeping our community and our staff safe. This last week, we have learned in the news that the pandemic could kill somewhere between 100,000 and 1 million Americans. And we were told by our federal government that the only difference is whether or not we follow the recommendations around social distancing, around washing our hands, around staying home. So that's a lie, because some people can't follow those recommendations. And I would say the big determiner on whether or not 100,000 or 1 million die in this pandemic in the next few months, the big determiner is how much our governments, our public officials really protect our most vulnerable. The most vulnerable who cannot follow these recommendations right now. And by that I mean the folks that don't have water or other utilities, the folks that can't socially distance because either they're homeless or they're working, they're service workers, or they're living large families living in very small spaces. And that's exactly the families that we're talking about in Detroit that are suffering from the water shutoffs. For years, We the People, Freshwater Future has been fighting on this issue. A couple of years ago, I came to Detroit and spoke about the public health risk of having folks that don't have access to basic human rights, to basic services like water. Water is a basic human right. And I said then, a couple of years ago, that this is a public health risk for everyone, but really that shouldn't be the reason why we're doing it. It's a basic human right for everyone to have access to water. And if we can do it now, if we can house the homeless now in this pandemic, if we can turn the water on now in this pandemic, we could have turned the water on 6 months ago too. The same issues exist even when there's not a pandemic. The same basic human rights issues, the same issues of spread and concern to the community, because who are the people that are suffering from having their water turned off, are suffering from having a lack of access to other basic utilities? They're the people who are our daycare workers. There are people who are cleaning our hospitals. There are people that are giving you your fast food when you go through the drive-through, or they're the people that are working in our grocery stores. They're the people that still have to go to work every day and interact with the public. And those are the people that we're putting most at risk for themselves and for the rest of the community. We've had pandemics in history. This pandemic is very much like the first pandemic to reach our continent. It's brought by privileged rich people, but it's going to affect disproportionately poor people and people of color. So I just want to say that I want to reiterate also what what Dr. Sternberg said, is that there's already health disparities with this population. This population, vulnerable folks, people of color, suffer under a huge burden of chronic disease, diabetes, hypertension, which makes them even more vulnerable to this disease. And so the fact that we've never addressed these health equities, and now we have a pandemic that is going to end up disproportionately affecting that community, is unconscionable. Right now we can do something, and that's great. And I'm glad that local governments are stepping up, because our federal government has been criminally incompetent in this. I'm glad that our local governments are stepping up, but it's not enough to just turn on the water for a few months. The water has to be turned on permanently, and the people's bills have to be forgiven. Water is a human right. And I hope if any good comes out of this pandemic, I hope we can all realize that. Thanks very much.
Thank you very much, Dr. Johnson. We will next move to Nadia Gaber, please.
Good morning, everyone. So I'm Nadia Gaber. I'm a medical anthropologist, and I'm a member of We the People of Detroit's Community Research Collective. And echoing what Monica and our Dr. Wendy said, I want to talk about the crisis beneath the crisis, and that's water affordability. This is a long-standing problem. It's a national problem, and it's exacerbating health inequalities in communities that have been left out of the most recent economic transition. And it's creating a kind of perfect storm for this pandemic. So water is not affordable, and it's becoming less affordable. In Detroit, you had a water affordability plan approved in 2005 and not implemented through objections of the water department, the city and state. You've seen rates go up 120% in 10 years. And rates today that well exceed the human rights threshold for water, so that folks in Detroit, as well as Flint and many other cities in the country, are paying more than double what we ask people around the world to pay for water. And it's a national problem. So we have studies that show that by 2022, 36% of Americans will be unable to afford their water. And that is a threefold increase over just 5 years. So we are right in the middle of this escalation, which is only going to seed, as everyone has talked about, the inability for people to practice basic hygiene and take care of themselves at home. So of course it does impact washing hands. Through the Community Research Collective, we did a study of 100 low-income women in the Brightmoor neighborhood of Detroit and found that they were changing their water-related health behaviors. So people were cutting back on their hand washing, their bathing, their cleaning of their homes and doing laundry, doing those things less frequently, or having to cut back a little or a lot. We found that more than a third were collecting water from an undesirable or dirty source, and that 84% said that they drank water they felt might be unsafe for their health. More than 80% were borrowing or sharing water among their neighbors. This was in 2016, after one of the most aggressive years of mass water shutoffs in the city. And it is a double-edged finding because it speaks to both how dire the situation is for people living in poverty in the city of Detroit, but also shows the robust cooperation in the community, which we see a great example of this morning with Monica and Deborah and We the People out delivering water in the city. So no surprise, we also found that there was a statistically significant and robust relationship between unaffordability of water and psychosocial distress. So we know that mental health is impacted, trust is impacted, and those impacts trickle out into the whole of a person's life and their household health. So we also did a survey looking across Detroit using disaster assessment tools from the CDC. And we didn't know at the time how appropriate and prescient that would be. But we found that 60% of Detroit households, which is likely a much larger percent of residents because you have an average of 3 people living in each household, had a person living with a chronic illness, mental illness, or disability. And when the Wayne County Health Authority put out a moratorium calling for water shutoffs for people who were vulnerable on the basis of their poor health, we found that 82% of residents in our random survey of the city of Detroit were vulnerable enough on health criteria alone to be protected for shutoffs. And truly, as everyone has said, there is no one whose health can sustain not having access to safe and clean water. And so the outsized burden of chronic disease in Detroit also, we know now, is going to make people more vulnerable to COVID-19 and its complications. You have an asthma prevalence in Detroit that's 29% higher among residents in the city than elsewhere in Michigan. And you have elevated levels of obesity, hypertension, and type 2 diabetes in the Detroit metro counties. And we know that each of these are risk factors for poor outcomes with COVID. So it's really the structural neglect and the underlying health inequalities, which are deeply seated and in this region racially rooted, that will drive poor outcomes from coronavirus and require a lot of direct efforts in not only turning the water back on, but as Monica said, keeping the water on, having a permanent moratorium on all water shutoffs. And we know from prior research, both a Henry Ford Health System study of water-related skin and soft tissue infections and GI bugs in the Detroit area following the shutoffs, and from a review of state data from former Deputy Director of Health, George Gaines, that there is an increase in many water-related infectious diseases from Shigella to Giardia, seen in Detroit and the surrounding areas, corresponding with the timeline of shutoffs. So when we look at a map of COVID today, it's no coincidence that those who are at highest risk are those who are left out of the basic protections of city services and the social safety net, and we have to do more to protect them, not only through this devastating crisis, but into the future as we will see affordability on the rise nationwide.
Thank you so much, Nadia. We appreciate that. So we will move to our last speaker at this point, Attorney Nick Leonard.
Good morning, and thank you, Jill, for having us. My name is Nick Leonard, and I'm the Executive Director of the Great Lakes Environmental Law Center. We provide legal services to help Michigan residents create solutions to environmental issues that are impacting their health and quality of life. And even before COVID-19 reached Michigan, unaffordable water service was a present but largely hidden public health crisis in communities throughout Michigan for several years now. Studies have found that low-income residents throughout the Metro Detroit region pay on average 10% of their monthly household income for water service, more than double the United States EPA's estimate of 4.5% of income as being affordable. Such residents that were confronted with these unaffordable bills were forced to engage in dangerous coping behavior, including cutting back on housing, medical, and food expenses to try to keep their water running. And residents that weren't able to keep their water running often had their water shut off, creating a public health emergency for everyone in that household as families were forced to find alternative sources of water for drinking, cooking, bathing. What COVID-19 has done is expand the impact of this pre-existing public health emergency. If a person lacks water service, they won't be able to follow basic precautions to stop the spread of the virus. They won't be able to wash their hands, and they'll be forced to go look for water at overcrowded and understocked grocery stores. Without water service, Michiganders would be unable to protect not only themselves, but also all of us from COVID-19. And that's why Governor Whitmer's executive order to immediately restore running water to thousands of Michigan households was so important. And we commend her for the leadership that she has demonstrated. But the work is really just beginning. Our attention now turns to making sure that this executive order issued by Governor Whitmer is quickly implemented. Specifically, every household that has had their water turned off must be identified by their local water system, and their service must be restored in a safe manner. And their water must be affordable now and after the COVID-19 pandemic. And that last point, water being affordable now and after the COVID-19 pandemic is really important, because despite record high levels of unemployment, many residents are still being confronted with water bills that are unaffordable. This issue of billing and water rates and unaffordability was simply not addressed by the executive order. Water systems have to restore service, and they can't shut off people's service, but there's nothing that says that they have to make water affordable. And affordable water is essential now more than ever. This is obviously a really crucial time in Michigan, meaning the present days, the present weeks, in making sure that every resident has running water at their tap is necessary to save lives. That's always been true, but it's even more urgent now than it's ever been. Thank you, Jill.
Thank you very much, Nick. We appreciate that. And that completes the end of our speakers list. Excuse me. Just to move to the next portion, we will be asking you to raise your hand on the computer. So if you go to the chat section, you should be able to raise your hand if you're doing this by computer. We're going to go to the computer questions first and unmute those folks that have a question. If there are questions for those on the phone only, we will take those questions at the end. So if you have a question, please indicate by raising your hand and we will unmute your line. Piper Carter has raised her hand. Piper, do you have a question?
Yes, I do have a question. For the two people that were speaking before, that you spoke about the impact, and I wanted to ask if you could give some very you gave the about washing the hands, and you gave about what we could basically do. Right now we have a petition. I'm a member of Frontline Detroit. We have a petition to ask our mayor to get the water, to make sure that the water department is getting the water on. But I'm wondering about, is there any specific information you can share that we could put online? Because all the information you gave is very wonderful, and it's very expansive. And I'm wondering, are there places where we could grab some of these statistics and some of this information and some of these recommendations that we can share to folks, so in a way that folks can understand it? Because we want to make sure that as many people as possible have access to this information in a way that they can understand it and continue to share it.
Piper, can I jump in for a moment? Dr. Sternberg here.
Please do.
A wonderful idea, and I think what we can do as a follow-up is create perhaps maybe a worksheet's the wrong word, but kind of a fact sheet and a few suggestions, just like people did with climate change. These are things you can do to decrease emissions or decrease this. We can do the same with this. And I think, to your point, one of the things I'd like to highlight is that if you think about a water bill, for the most part, maybe is between $100 and $120 a month. If that same person has no water, gets sick, takes an ambulance to the ER, goes through the ER, gets admitted to the intensive care unit, gets put on a ventilator because of respiratory compromise, demise, where their lungs have this interstitial pneumonia that we know is the COVID-19 virus is causing, that bill, by the time that person is done, could be north of $500,000 if they're not dead. And if they are dead, they have the hospital bill plus the graveyard, plus the funeral services, plus all of that. And this is the kind of debt that, no pun intended, would bury not only that person, but their families for many, many, many years. They probably would never come out from under that kind of debt. So $120 versus north of $500,000. Anybody with any sense of intelligence and conscience would not allow that to happen.
Thank you, Dr. Sternberg. Did anyone else want to respond?
Yeah, I'd just like to say, I mean, I appreciate what Dr. Sternberg said, and I like the idea of us kind of compiling a fact sheet or a white paper on this. But to Piper's excellent question, I mean, there's two parts of it. One is, how do we get the information out to folks who are in the grassroots and who are doing work and having petitions? And two, how do we leverage that information to petition the city for permanent progress. And so I do want to mention the studies and the statistics that I've cited are available online at wethepeopleofdetroit.com. We put them on the Community Research Collective site precisely because the intention of the work was to mobilize volunteers, and I didn't talk about our process, but this was all residents and advocates and volunteers in the city of Detroit who got together to do this research, and that was by design so that the research would be owned by and for the residents of the city of Detroit to use. So you can find that online. And I know our own professor, Emily Kudel, is also working to get more of the recent data on not only shutoffs, but folks who have been shut off and never reconnected, and trying to correlate that with a map of where coronavirus is to try to drive home this point that you can see really visually through mapping techniques, the overlap of leaving people without water, without the basic protections, and an infectious disease pandemic like this.
Excellent. Thank you so much, Nadia. Dr. Johnson, did you have something?
Really quick. We have some really excellent guidance for individuals. I think you were asking about that too, Piper, I'm not sure. But for individuals who might not really be able to self-isolate, like homeless individuals, like folks who have issues with their utilities, like folks who are service workers. We have that in both English and Spanish, and there are good resources out there. And I can try to get links to Monica and maybe put some of that on the We the People site as well.
That's wonderful. So thank you, everybody, for those answers. Piper has thanked you as well in the chat. And we will definitely, Freshwater Future and We the People will be happy to collect these, and we will be sending links where you can find everything. So we will do that after the call, along with a link to the recording of this call, as well as we will post bios from our speakers. So we will put all that together and send it in one email to you later today. All right, we will go to the next question, which I see is Bill Wiley-Kellerman.
Hi, everyone, and thank you all for the good work in this conversation. My question, and maybe it's even obvious and implicit, but Detroit is nationally a hotspot for accelerated spread of the virus. And architecturally, the city is structured not like New York or even Chicago, where people are stacked on top of one another, but very spread out in single family homes and duplexes. So the question of why Detroit is a hotspot has to raise, why is that? And I can think of a number of things, but the water shutoffs has to be on that list of what's overcoming and otherwise potentially safe space architecture. That is a question, I think.
Okay,
well,
thank you for that.
Oh, sorry, Jill. I don't know if Monica's still on. There was a great study done a few years ago about the water shutoffs and greater emergency room and transmission of disease. So if someone from We the People who can reference that or knows what I'm talking about. It was a couple of years ago done. I don't know, Nadia, if you can talk about that.
I'd like to jump in with another comment. This is Dr. Wendy Sternberg again. When I worked in India, they had to create an entire area in the hospital in the south of India in Egmore, at the Egmore Children's Hospital, that was called the diarrheal ward. I, as an American, couldn't even go into that part of the hospital. That's how laden it was with organisms just on the mattresses. When we look even in first world or non-developing world countries, we swab curtains and carpeting and fabric in our hospitals, even in Chicago, and we find multi-drug resistant organisms. So this is this is a really, really key thing to realize. And it goes back to what Dr. Wendy Johnson was saying about, this is not just about COVID-19. This is about infectious disease. COVID-19 is to infectious disease as a Cocker Spaniel is to a dog. So it's just one of many things. It happens to be the horrific one facing us now. But we need to do this for everything.
Yes.
Yeah, I'm
Go
sorry.
ahead, Nadia. Thank you.
So I believe that Dr. Johnson is referring to the Henry Ford Health System study that was done by Alex Plum and Dr. Zervos and Kyle Moxley. And they found that there was a geographic relationship between having your water shut off and presenting to the emergency department of Henry Ford Health Systems and being treated for a water-related skin, soft tissue, or GI disease. So infectious disease and water shutoffs were correlated at the neighborhood level and at the block level. So actually, really interestingly, it wasn't just about whether you individually had your water turned off. It was about living in a neighborhood with other people who were disenfranchised, marginalized, and left out of an essential public health infrastructure. And I think that gets to Reverend Wiley Kellerman's point about the geography of Detroit really making a difference in how health inequalities manifest, and how difficult also it is for people to access the kinds of healthcare services that might ameliorate them. So just thinking about this current situation, I mean, Detroiters are disconnected from a lot of public transportation. They often live in neighborhoods with very scattered or splintered infrastructure. So you don't have full access to public services. Grocery stores are incredibly far away. In our study that of the Casper, when we went around doing volunteer collection of data, we found that people were sharing transportation. Most people shared a car. So getting to a grocery store, and as Nick mentioned, these are now, if you depended on bottled water, you're having a really hard time now going to a grocery store to buy bottled water when others are stocking up. So there's layers of, it would be a much longer conversation, but I think it's a really good point for people to think about how the experience of the extreme vacancy and the kind of patchy level of service in the outlying neighborhoods of Detroit really complicate the ability for people to shelter in place, stay in their homes, and still access the essentials of what they need, like food, water, and good shelter.
Thank you very much. And I will let folks know that We the People has already posted that study to the chat box if you're interested, but we will also link that in the materials we send out after the meeting as well. So thank you for those. We have a next question. Nina Ignazak. I'm sorry, I know I'm not saying that correctly, but if we could.
That's pretty good.
Okay, excellent.
Thank
Go
you
ahead.
so much. Yeah, thank you so much for doing this today. I'm Nina Ignazak. I publish Planet Detroit newsletter, and we're a local source of news on the environment. I have two questions. Number one is, there was a really informative article that came out late last night from Bridge Magazine that actually broke down the cases by municipality and used that as a way to kind of correlate to racial prevalence, but of course it's not perfect, and the race data isn't being reported. And in the article, they mentioned that several epidemiologists and public health experts that they spoke with did not think that it was a good idea to release race data because it would foster discrimination potentially. And I just wanted to get any of your perspectives on the pros and cons and whether we should be reporting data out by race at this point.
Any responses to that good question?
I think it's a good question for Nadia, but I always think we should be reporting data out by race and socioeconomic status. And that's one thing I've been really frustrated about, you know, we're in a pandemic, we're trying to get data out quickly. I understand that, but I'm really wondering, even up to this point, what is the breakdown of who's being affected and the deaths and all of that? There's no good source of data in real time, but I think when we look back on it, we're going to see that the poor and people of color have been disproportionately affected.
Yes, and I'd like to piggyback on that. We're both Wendy, so I'm Dr. Wendy Thank you, Dr. Johnson, also Wendy. I think one of the issues in this environment that we're in, where there's so much animosity and things have escalated to a great deal of othering, is that then we start to move in a direction of being politically correct and hiding behind things. We are in a place where we need to name things for what they are. This is not just criminal, it's a crime against humanity. And if we're gonna get anywhere with this, we need to show all the people that are part of humanity, not just the ones that look like most of us. We need to show humanity in all of its colors, all of its beauty, all of its ugliness, all of its socioeconomic layers. We need to show the totality of humanity, to show the crime against humanity. And by hiding behind, well, that may be making certain people feel bad, or those people, we should hide them away, we're doing a disservice to our collective humanity.
Thank you, Dr. Sternberg. And Nadia, if you'd like to go, and then we're going to bring in also Dr. Peter Hammer for a response to this.
Yes, thank you. I was just going to suggest also inviting Monica if she's still on the line to speak on this. And I'll just say a brief note and then happy to turn it over to Dr. Hammer. But I think part of the, I think there is a legitimate worry, of course, around stigma. And one of the constant issues in doing poverty research in the United States, or in talking about poverty in the United States, is that you do have to recognize it is racially rooted. It's very deeply seated. It is built on a geography of racial segregation that has been patterned into the fabric of American life. And so we can't get away from that fact. And at the same time, I think we do need to always be naming and talking about the structural determinants of these racial inequalities, and not just kind of counting them as given facts, and instead noting in each report, in each newspaper article, that these racial disparities were produced by particular political and historical decisions, and that they also complicate the experience of living with health inequalities, of living without water, and of being able to access infrastructures of care. But there's much more to say on the topic. I think I'll just turn it over to Dr. Hammer.
Great, thank you. Dr. Hammer, are you able to speak now?
Sure. I think it's an important question. You can't think about what's happening in Detroit without thinking about decades and decades of spatial structural racism and how that creates unique forms of vulnerability and how that's being mapped out, not only in the data that already exists about health inequalities, but the particular vulnerability of the COVID virus. So we need to collect data. We need to put this crisis within a framework of spatial structural racism, both as we're trying to accurately diagnose what needs to be done in the moment, as well as how we pivot from this crisis in the future, and really trying to center racial equity, structural racism analysis into how we're going to be moving forward in a post-crisis world. That said, there are also dangers, and at the same time that we're trying to deepen and have a more nuanced analysis, we have to safeguard against discrimination. There's discrimination against the Asian community that is associated with this pandemic. There's no doubt that there are white minds in Michigan and elsewhere that will interpret data in ways that will further their own sense of racial discrimination. So it's a both and. We can't not do a racial analysis, and we have to also safeguard against the risk of discrimination.
Thank you so much, Dr. Hammer. We appreciate that. I want to give Monica Lewis-Patrick a chance to jump in here if she's available. Go ahead, Monica.
Just once again, want to thank everyone. And as we're having this discussion today, just want to make sure that the critical issue that's lifted is that humanity deserves the right to drink clean, safe, and affordable water. So we will continue to do the analysis. We'll continue to lift up the science. But what we really want to make sure that happens today, that nobody gets off of this phone line not understanding that we have found a good fight and we all better get in it. And it's for the human right to water.
Thank you very much, Monica. Well said. Excuse me, I'm sorry. We have a few folks giving us good links in the chats. I just want to let you all know that we will try to collect those links and include them in what is sent out. I also have a question from Molly Lebov asking if there's a source on the China cremations situation. Do we know if that exists, and if so, we can include that in the information? Dr. Sternberg, are you able to, let me see.
One actually just sent a link.
Yeah. Yes, I have the link. I emailed you because I couldn't find it while we're on the program. I have the link, and I forget which, whether it was in Politico or Bloomberg News or something else. I also want to add one more thing, piggybacking on what Monica just said, and this notion of naming things for what they are that all of us have touched on. I think we need to start using the word genocide in this. This is a global genocide. We need to name this for what it is, not just as a crime against humanity, but start looking at this akin to other things in the world that killed massive amounts of people. And that elevates this conversation and the urgency of addressing these things.
Thank you very much, Dr. Sternberg. I see that Natasha Blakey Blakely in the chat box has given us a link to a Bloomberg article on that. I also see we have another question from Nina. What does the situation look like right now on the ground with respect to restorations? Are organizers seeing a difference? I don't know if Monica is still on the line. I think she's literally on the ground today and could say something about that. If you are available, let us see you, Monica, and we'll be happy to hear an answer. I will chime in. This is Jill Ryan from Freshwater Future as well. And we know we're hearing across the region, not just from Detroit and Michigan, but other cities as well, that this is a difficult thing because municipalities and utilities don't necessarily have good records on who has been turned off historically that may still be shut off. And so that is one big concern. We know many municipalities are trying to move forward with turning people's water back on, but it is a difficult process, and you do have to get people out on the ground to make those reconnections. So I would be happy to have any other speakers respond to that as well.
I'll just say briefly, I mean, the fact that Monica and We the People continue to be out delivering water is an incredible testament to their resilience, but also to the fact that it was not possible to reconnect everyone in an instant. And that is one of the consequences and the risks that was taken in agreeing to and continuing these mass shutoffs at such a high and unprecedented level over the many years. And I know that there were early concerns among organizers that restorations weren't going fast enough. I do know that the People's Water Board Coalition put out a statement, which is on their website, about in the first week or two what some of the numbers looked like, what their concerns were about returning people to service. But I think Jill's point is also a good one. We don't have, we don't know that there's good record keeping of who's been shut off, and if people aren't actively still with their account, they may be living in homes without water for months and years, and they go uncounted in official reporting of data or averaging, for example, of how long people are left without water. We found that in our survey, and that's available on We the People of Detroit's website. But it also does go back to Bill Wiley-Kellerman's point about density. The vacancy of the city really complicates these problems of counting. And so I think we always have to remember that there is a significant and structural undercounting because of that social and spatial racism that Professor Hammer talked about. So when you're using, for example, census data that is now at this point almost 10 years old and was released just after the foreclosure crisis, you had these waves and the bankruptcy as well, and the continued foreclosures that are underpinning all of these and very much tied to the water shutoffs that have really left people out and uncounted. So it's a very difficult question to answer because of that problem as well.
Thank you.
And I just want to,
thank you, Nadia.
I just want to add one thing. I just want to add one thing to that. Sorry. This is Dr. Wendy Johnson. I just want to say one thing we really haven't mentioned is the issue of undocumented immigrants and also the issue of telehealth, those two things. So right now, there's a potential for access to healthcare to even be more difficult for folks who are in the situation of not having access both to water and other utilities, like not having phone, not having electricity, because almost all medical services, except for emergency medical services, are going to telehealth. But a lot of these same folks don't have working telephones, don't have, they're having to pay all their other bills that they're not able to pay because a lot of them are laid off, and they don't have access to those things. So the access to healthcare is one thing that's even going to get more exacerbated along socioeconomic and racial lines due to this pandemic because of the shift to telehealth. The other thing that I wanted to mention is about undocumented immigrants. Undocumented immigrants were already being marginalized and pushed away from any kind of public service because of the public charge order that Trump released in October of last year. So we were already seeing in our clinic that serves maybe about 35% of our patient population as undocumented immigrants. We were already seeing those folks not coming in for care, not accessing things like food assistance that they previously had the right to access. Even US citizens not accessing things because they had family members who were undocumented immigrants or even documented immigrants who were going through their process of getting citizenship, and they were afraid that it was having a huge chilling effect already on accessing public services. Now when those public services are even more important for that population, they're still afraid to access them. And I just wanted to mention those two other factors.
Thank you, Dr. Johnson. That's very helpful. Before we go on, I just want to, we're getting toward the top of the hour. I want to ask to have the phone lines unmuted just to see if we have questions on the phone lines, please.
And while we're doing that, Jill, I'm afraid I have to get off because I have another call in about 5 minutes. So thank you very much, everyone, for having me. I sent my bio out to everybody, so you can have that. And if there's anyone who wants to contact me, I'm sure we the people can get my email to folks. Well, you have my email because I sent it up in my bio. So feel free to email me with more questions. And thanks, everybody.
Wonderful. Thanks. Thank you for being on, Dr. Johnson. Okay.
Jill, I have one thing to add, if I could, on the heels of that before you take another question. Would that be okay?
Yes, please do.
Yeah, so in terms of this notion of raising the awareness and the issue of the marginal communities that are multifold, not just Black and brown, but the whole refugees, undocumented immigrants, all of that. One of the things that happened in Chicago that I think is something to pay attention to is while water shutoffs were happening for non-payment in the southern suburbs of Chicago, Mayor Lightfoot put out an edict that no one in the whole entire city of Chicago would have their water shut off for non-payment. And what happened was that edict helped pressure the southern suburbs that are technically not within the city limits to follow that dictate. And so there's this notion of creating a certain amount of pressure to groups that are doing this, whether they're in city confines or not. And when we look at city sprawl, we need to think about these kinds of things. And I think the ability of grassroots organizations to pressure municipalities and pressure government entities and work with mayors that understand this is vital to human life.
Excellent points. Thank you. I see, Nick, did you have a response as well?
Just a bit on sort of how things are going on the ground. The short of it is most water systems don't keep data regarding where they shut people off, and which has made it really hard at a really crucial time to restore service. The executive order basically gives water systems until April 12th 10 days from now, to issue that initial report that Monica had mentioned, where they have to basically identify the number of people that have had their water shut off. And I think this just speaks to the issue of water unaffordability and water shutoffs just in the general context before COVID-19 even reached Michigan. It highlights that water at all times is an essential service, and that it's not just something that you can easily turn on and turn off. It's something that needs to be affordable for all residents at all times. And if that's not true, then communities are susceptible to things like this.
Thank you very much, Nick. We're approaching the top of the hour. I think we have a few people who are trying to ask a question. If you are on a phone line and have been unmuted, could you go ahead and ask that question now?
I have a couple. This is Christine with the Detroit News.
Hi, Christine. Yes, please go ahead.
Hi, and I apologize. I missed the very beginning, but I was wondering if anyone could clarify what specific actions or methods you're taking, to make the demands that this is followed through with and this is really implemented, the restorations, like as groups working together.
So that's a great question. This is Jill Ryan. I'm going to step in for just a minute on that one. I'm from Freshwater Future, and we, the people and the Great Lakes Environmental Law Center and others are actually advocating for the governor to use an existing entity that she already has at her disposal, which is the Michigan Advisory Council on Environmental Justice, as a tool to be able to look at whether municipalities are meeting this order. So that is something that we think could be useful in this. And that's one of the things we're asking the governor to do.
And
did you submit a formal request on it, or laying out the things you want to make sure are done?
We're talking to the governor's office. And yes, that committee will be, I think, making that request. Nick, did you want to talk a little bit more about that?
Yeah, and one of the other things that we're doing to really make sure this is properly implemented is just really sort of watchdogging the identification of residences that have had their water shut off. That's really going to be, it's going to be really important that these reports that are submitted to EGLE and sort of the investigations done by local systems to identify the households that have been shut off is true. And it's going to take a lot of work to do sort of that quality control, and it's going to be a lot of sort of ground truthing and just sort of getting public records to try to see basically whether water systems are sort of following through on this promise to make sure that all residents have running water during the pandemic. That's going to be crucial.
On top of that, I'm wondering, I just wanted to add, I'm sorry to interrupt, but I was going to ask you, is there any sense of how many water suppliers in our state are using shutoff as a tool? And how realistic is it that these reports are really going to be done by April 12th?
We have that sense through a report that was published by We the People that surveyed essentially water shutoff policies throughout the Metro Detroit region. And my understanding of that report is that water shutoffs is a more prevalent tool in communities of color and lower income. And so I can make sure that you get access to that. The point on can systems do this by the 12th? I mean, ideally, they would have been doing this.
Take a look at what I put on that.
This executive order was issued. They would have
put due to some technical difficulties, we're unable to air it live, but you can see it on our Facebook.
Some systems had been doing that, other systems hadn't, and so some systems will be able to do it more easily than others.
And I would like to add, Dr. Emily Kudel from We the People has posted a comment. She says, to be clear, water utilities do keep data on who has been shut off. they usually do not make those numbers public. So instead, we all have to rely on constant public information requests for media or community organizations. They've not kept track of households that remain shut off. So they also do not track any demographic data about residential customers or even whether a house is occupied or vacant. So those are all factors that lead into not being able to know quickly where to go to turn water back on, I think. Monica, I see you're back with us. Would you like to make any comments as we close?
I just would also want to make sure that we are lifting a couple of things. One is that laundromats are essential service to communities that are low income and do not have washers and dryers in their homes. So we definitely have to lift that up as a public health need in terms of essential services. I know that many of the governors have not allowed those services to be categorized that way, but I'm hoping that with the medical community and public health community, we can lift that not only at the state level, but at the national level. And then the other thing that I would say to those that are investigating issues around water shutoffs and water restorations is that we also need to look at the Treasury Department and finance and budgeting for some of these communities, because there are invoices that should track. I know in Detroit, the Homrick shutoffs are deeply connected to the addresses. So if there was some investigative reporting that could actually look into that, you may find that there's direct correlation between what we have speculated, what we have been able to prove, and then those questions that still are yet to be answered. So that's something I would suggest, that definitely we know in Detroit that everywhere that there is a shutoff, there is an address that's connected to how they are paid.
Thank you so much, Monica. Appreciate those comments. We're at a few minutes after the hour. I know probably most of our speakers have to move on. I want to see if there is one last question from a phone line, and then we'll give speakers a chance to kind of wrap up and we'll close out. Those on phone line, any last question? Okay, why don't we start with Dr. Wendy Sternberg. Would you like to make any last comments?
Yes, I would. Thank you. You can hear me okay, right?
We can.
Okay, yes. I'd like to make two final comments. Well, just in general, I think one of the most wonderful things about a program like this is to heighten awareness. So I shared with a number of people and sent the press release about this around to all of the media connections I have with Genesis at the Crossroads. That includes TV, radio, print, etc. And I think this notion of an awareness campaign is really important. People were absolutely horrified when they heard that people's water was shut off just in general, but specifically in this pandemic. So I think the journalistic piece of this is incredibly important. So I would encourage all of you that have listened to this, all of you that are from the media, to share this with other media. And social media is a great way to get this word out. The other thing is that I think because the economics are such a big part of this, there's price gouging, as you heard from Nadia and others. There's structural realities that are surrounding and embedded in this issue that are magnifying this problem. I actually think the people that are shutting off the water and doing all these things are making tremendous amounts of money. And one of the ways to pressure them is to penalize them with money. And when that is published, as this particular entity got penalized for shutting off water to this level in these numbers of homes to this degree, paying this amount of money, you're going to start to have, for lack of a better term, public shaming of those entities. And that will drive behavioral shifts. So I think we're looking at a lot of behavioral changes. People are learning in society how to wash their hands. What a concept. That is something we should have learned in kindergarten. Okay, we're learning it now, and that will save us going forward. And if that's any silver lining from all of this, it's a very good outcome. The second thing is that this notion of interconnectedness and us all being interdependent, that if disease is higher in one group, in one poor section of a city, it doesn't stay in that group. because this is infectious disease. The virus doesn't care how much money is in your bank account when it's spread on the wind, when it's spread by a droplet. It is affecting everyone, all of us. And until we all really understand that I'm connected to you and you're connected to me, and our survival, both of our survivals are intimately intertwined, we can never shift anything in the world. So I think that's the greatest message. And additionally, that people are not going to work sick. I even worked in a medical practice where a young doctor came in with the flu during one flu season a number of years ago with this bravado that she was so, she was one of these people that never stays home and she always goes to work. Well, that's just propagating a disease, and it's wrong.
Thank you. Important points. Dr. Wendy Sternberg, thank you. Nick, could we go to you next? Nicholas Leonard.
Yeah, sure. Thanks, Jill. I just want to sort of emphasize that while we're happy that the water is being restored, there's I think two main issues that we're really concerned about and working to address going forward. The first is the water should have never been turned off. That nobody should have their water turned off because they can't afford to pay their bills, and that it really exacerbates public health crises like the one that we're experiencing now. I think the other key issue that's sort of we're more immediately concerned about going forward is the fact that the executive order issued by Governor Whitmer did not change how water systems charge for their service. They can't, water systems currently have to restore service, and they can't turn people off during the duration of the state of emergency in the state of Michigan. But we're very concerned that water systems are going to keep sending people bills. People won't be able to afford them because they're losing their jobs. And come the end of the emergency, there will be sort of the second crisis of people now having to deal with those bills and once again confronting shutoffs and once again confronting that very serious public health issue in and of itself. So we're working on both of those issues and working with a lot of people such as Freshwater Future and We the People of Detroit to try to make sure that they're addressed. Thank you.
Thank you very much, Nicholas Leonard. And finally, we'll go to Nadia Gaber, please.
Thanks. I'll just say briefly, we've been calling out this public health crisis and this danger for years. And we know that water unaffordability and the water shutoffs are just a crisis beneath the current coronavirus crisis. The city's claims over the years that there's no data to show that shutting off people's water en masse has a public health harm is really not a good faith claim because they've conducted no research into the problem. And it's really the city and the state health departments that remain in the best position to gather that data. I want to commend the work that We the People of Detroit has done and the community members who have volunteered to make that research possible in the midst of the structural neglect that has been imposed on them and the work that is being done right now to provide emergency water relief. But putting numbers on the problem can be very useful in terms of advocacy, but it may also obscure just each of us operating from the thinking informed by our own everyday experiences of living with water, knowing how much it sustains us, knowing that it impacts our ability to work, to play, to pray, to live, to be with our families, to stay safe, and to trust our government. And that should inform our thinking about the indignity as well as the danger of cutting off those who are too poor to pay all across cities like Detroit. So this is the public health emergency we have been talking about. It is what we have most feared. And while we commend the governor for stepping in to restore water during this pandemic, we hope it becomes imminently clear that water is absolutely vital for everyone, crisis or not, and that it is in the interest of everybody to make water affordable across this country.
Thank you very much, Nadia Gaber. Again, my name is Jill Ryan from Freshwater Future. We're going to close the formal call in just a moment. We will be getting information out to you. If you have ongoing questions, we will be happy to also help connect those questions to folks that might be able to answer them. So don't hesitate to reach out to us and send any last questions. One last question that we received in the chat is, do we have concerns about water being turned on too late? And I will just take that as a last way to close us out, because we absolutely do. I think it goes to the content of this call that we think water is a human right. It should be on at all times, and that having to have this call and have municipalities trying to figure out after a pandemic has started how to turn the water on and where is way too late. So right now is too late, but we still have to do it, and we have to do it as quickly as possible and as safely as possible. So I just want to thank everybody. All of our speakers have been amazing. Thank you all for your time and your expertise in sharing that with us. Thank you to We the People of Detroit for helping to organize this and pull it together. And thank you to everyone who attended. And we hope to see lots of great stories that come out of this session. Thank you all.
Thank you.